Hello, this is John Kanellopoulos from Athens, Greece, in New York City, New York. I'm very pleased to convey you the message that the ISRS, the International Society of Refractive Surgery, a partner of the American Academy of Ophthalmology, has worked on your comments from the annual meetings we had the last few years, and we have condensed our two-day program into a one-day program to be held this year during the American Academy of Ophthalmology meeting in Las Vegas, Nevada, on Friday, November the 13th. With this video mail, I want to urge you to pay your dues to the ISRS. The International Society is a very exciting home for innovative refractive surgery, either cornea or lens-based. It is my honor to co-host this annual meeting with Bonnie Henderson of Boston, Massachusetts, who of course needs no introduction. We have an action-packed meeting, which, as I mentioned, is held on Friday, so it will not compete with your desire to attend other subspecialty meetings on Saturday. We will have novel diagnostics of the cornea and for IOL calculation, even in very difficult cases. We will have a very exciting session again on video complications and their management in both lens-based and cornea-based refractive surgery. We will continue with our patient-physician interaction session. This is a very innovative session we started last year. In this session, we have two invited physicians play, one of them the role of a patient and the other one the role of a doctor. And we have selected very hot and difficult topics that you may encounter in everyday practice to be discussed, to be humored. A very exciting session last year. We'll hear the newest on customized ablations, on the use of femtosecond lasers in both cornea and lens-based refractive surgery. We'll have, of course, the break with the experts, where you get to speak one-on-one with experts in collagen cross-linking, in IOL calculation, phakic IOLs, cornea ring segments, etc., etc. I'm most excited about the members-only lunch, and of course, this is another reason to pay your dues this year to the ISRS. I guess the only excuse for not paying your dues is if you're based in Greece. No, just joking. In all seriousness, the lunch special members session will be a working lunch where we have invited some of the most outstanding ophthalmologists in our field of expertise, lens-based and cornea-based refractive surgery. They're under 40, and they'll bring the fresh outlook of the young ophthalmologists and the issues and the principles and the novel techniques that they have acquired and they practice in their everyday clinical situation. Last, we have a subsession by the European Society of Refractive Surgery, so we're here specifically for some of our European experts, members of the ISRS. And as always, our session on Friday will close with the latest news from the Journal of Refractive Surgery, the poster of the International Society of Refractive Surgery. As far as the scientific material, we claim that we have the most novel, the most exciting papers published at the JRS, and you'll get to hear from the authors some of the most exciting papers presented in our session. So contact the ISRS. You must have received a notification to pay your dues. I think it's a small token to keep this tremendous organization going and to be able to host another exciting meeting this year in Las Vegas, Nevada on November 13th. I look forward to seeing all of you here, and I'm signing out from Athens, Greece. This is John Kanellopoulos. Thank you very much for your attention.